Hey everybody. It is coming up on 8:25. Figure we'll get on, talk a little markets, do a little research, spend some time working on the bots right now. So the bot channel is up and running, and you can see that on the screen. I got 3 scripts running. I got to test out a couple more, and I'm just working on some stuff. So that's what I'm doing here. But I want to also update you on the markets, maybe talk about some setups, and then take some questions. Have a good time tonight. Pretty much just a relaxing evening here at Day Trading Radio after hours session. The after hours session for this January. What are we up to? January 7th, I believe, right? January 6th. But we're really getting ready for January 7th, which will be a Tuesday. Today's Monday. And believe it or not, the futures are higher right now. Started off, futures opening up, and they popped up. Well, actually, they closed. Then we started out at 6 o'clock, chopped around. Then we started rallying a bit, and we just came off the highs here, but we're up 350. And like I said, I'm doing some bot testing right now. Got some people in the room, so we're going to hang out. Got some great tunes playing. Had a good day. Villager, shout out to Villager's beautiful wife and daughter. That's awesome. They're playing in the car, listening to the oldies. Now he has his own personal DJ. Would you like anything special? I'll even play. How old's your daughter? I could play something like what a daughter's like. I want to guess. One Direction. One Direction. 13. That's perfect for One Direction. Or maybe my kid, my son is going to be 13 in March. In a couple months, he's going to be 13 in March. Imagine that. And he likes to Imagine Dragons. So I'll play you with some Imagine Dragons. Or I could just turn you on to the good music and let you play the 80s, which I try to force my kid to do. But it's always a battle, so I have to sneak it into him. I got to sneak stuff into him. He'll think a song will be bad until he hears it in a modern movie with The Rock, and then all of a sudden it's a great song because it's in a movie. So let me pull out something. I got something. I got a twofer for Villager's daughter out there going out on a Monday night. They're driving around. Let's see here. I want to play you one of mine. When I was 13, it was no. I'm not going to do that. That you won't understand any of that. I'll play you something that's from the 90s you probably haven't heard, but they're great anyway. We'll start off with a little Blink 182, and then we'll play some Imagine Dragons. All right, I'm getting it going here. Private DJ in the house. Did she know that I could actually see her blushing through the app on your phone? You can tell her that we have that technology here at Day Trading Radio. It's a slight tinge of pink. Enjoy the song. Enjoy the song. I want to enjoy it too. I decided to turn it up. This trading idea again. All right, we're going to get RPM on here in a second, talk some Bitcoin and see what he's doing. I'm feeling better today. I was wiped out today. What a roller coaster day I had. I started off everything good. I had some puts I covered early in the morning. I was already up $600, $700 for the day, and then market kind of just dragged, and I lost like some value in some options, and I guess because I have so much AUPH, and if that was down for a while, and then it turned around, and then Boeing turned around, I ended up the day up nice. I'm like, wow, that was a big change, and it all happened like the last half hour of the day. Last half hour of the day, everything changed from negative to big positive. So I'm in a little better mood now. It was a weird day, though. Weird. I couldn't get some of my trades in. And then all of a sudden, everything corrected right when it got closed. I guess I had things settling and stuff. It was just... something was wrong with I had to start my platform a couple times. Let's see here. Let me see if I can find my Skype. You know what? I didn't even consider it. It might have been the Iranians. And I was laughing about that today. And look at me. Can't get online. I'll Rainbow Six those suckers. I don't know. I mean, it's after hours. I guess I could get into a little bit more tonight. I could get into it a bit, but I was watching, catching up on the whole conflict and what the response of the Iranians are going to be, and if they have these troops, that they're highly trained troops, and all of this just doesn't play, doesn't make sense. I see these guys running around the desert, but they don't look like any fine trained troops. I don't know. I just don't see it. Hey, Paul.
Hey. Sorry, it took me a bit. I had to change the password on Skype again, and you know what that's like.
Oh, yeah. No, I'm sorry I missed your call earlier.
No, it's okay. I was in the office, just me and Bobby building computers. And I heard you pop up on my on the YouTube. So I heard you on there, so I was sending you a text message. I noticed that member Monster signed up for a lifetime membership.
That's today. Awesome. Yeah, yes. I remember he said hi to me, and did we meet him in Vegas?
I don't remember. I think he was a trial for a while.
I remember Monster. No, maybe not. No, I have not met yet. He'll be back in a bit. Took some time off from trading. Glad to be. Team is still strong. All right. I just caught up on this text. It's what time is it? 8:44.
You at the house or the office?
I'm at the office tonight.
Oh, okay.
Yeah. So I saw you post out. I saw your post in there saying the 10 times, and your leverage and you're claiming this stuff. Is this that new thing that you were talking about a few months ago with this guy that you were listening to, and he said this is the way you got to do things?
Well, it's not necessarily. Well, it depends on the type of account you have and where you have your crypto.
Yeah, but was that guy that you were mentioning that that you said, oh, John, you got to listen to this stuff. You get them. You got to tell me if that was the same thing or not. Just so
I don't remember. I listen to so many people on YouTube.
No, this guy was like someone that you were really, really pumped up about, and he had this way that you would give it. You wouldn't. They would stake you the money or something, or
Oh no! You're talking about the guy with the hex coin.
Oh, maybe that was it. Yes.
Yeah, that's Richard. what's his last name? Richard. He's a fairly famous guy now in crypto, but he does a lot of stand-ups and stuff at the conventions and all and everything. He created his own coin, and it runs off of Ethereum. And
How is that working out?
Well, it went huge. So he
disappeared.
He can't disappear. I mean, it doesn't matter if he disappears. It's all on smart contracts on Ethereum. It will always run. It'll always play out.
All right.
So it's not one of those things where now he's already rich because you deposit Ethereum into a bucket and the bucket belongs to him, and then the other end it spits out hex coin, which is designed to only go up in value. It can never go down.
Yeah.
And so far that's working out. But I decided not to do it, even though you can get your hex coin completely free. All you have to do is own Bitcoin during the snapshot period, which was back a couple months ago. And I had almost 3.25 coins back then, which I can go in there right now and claim free hex based on doing a signature on to prove that I owned the Bitcoin back then. And they would give me free hex. It cost me absolutely nothing. Wow. But as the time goes by, claiming free hex dwindles down to almost nothing after a year. So I just haven't messed with it. I don't know. But no, it's not that. I've been trading the BTC, and I posted in the room a couple of times today. I still have a weekly buy divergence on it, and it's bouncing off the 200 EMA on the weekly.
So these are just technical trades based off of divergences and everything. Yeah. That's great. And when you get a lot more leverage, you're saying, for the Bitcoin. Yeah.
So I'm using Bybit. It's BYBIT. Anybody can join.
BYBIT.
BYBIT.
All right.
Yeah, you can just search for it. I can't remember if it's .com or .io, but they've been around for about 2 years.
Okay.
So it's another leveraged exchange, and they don't like Binance. They kicked everybody out in the United States. They started their own exchange. Just got know your customer, KYC, and all that, and everything. You got to jump through hoops, send them driver's license, and all that stuff. But the traditional Binance, they told everybody you can't trade on their platform anymore if you're coming from the United States. So that happened back about 4 months ago. So I found Bybit, and Bybit offers leverage all the way up to 100x, I think. So, like, if all you have to have is just Bitcoin or you can trade. I forget what other pairs that they have, but you can just trade just pure Bitcoin. So, for example, I don't even convert over to U.S. dollars anymore, or U.S. dollar tether, right? Which would be like a 1-to-1 with U.S. dollar.
Yeah.
I don't even convert over anymore. I just take part of my Bitcoin and go long Bitcoin with my Bitcoin. And I know it sounds silly, but that's the way it works. You just have leverage against it. So you can just pick, there's a little slider, and you can pick how much leverage you want. So I used to do just 2x and 3x, and it would only be going long. So I'd see a trade or whatever. I'm already long Bitcoin anyway because I'm in Bitcoin, right? I'm long Bitcoin against the U.S. dollar, but if you look at it as it's just Bitcoin, then you just look at how much coin you have.
All right, yeah.
But so you just you pick your level. I usually look for a pullback, and then I just stake a certain amount into the trade and hope it bounces. And
when you say stake, this is like you're placing your trade. You put your money up.
Yeah, you're placing your trade. You're actually stacking on leverage. So let's say Bitcoin goes up $100 in value. Okay, which is typically if I get $150 to $200 on a trade, I'm good. But let's just say it goes up $100 in value. In theory, it would be like if you had 10 coin, you had 10 times as much on instead of just 1x, because I'm already 1x because I'm in Bitcoin.
All right, so it's just a highly leveraged thing. It's
well, I mean, they go all the way up to 100, but it's crazy because you can get wrecked so quick. All it has to do is just slip a little bit, and they'll liquidate your ass.
All right, so that's it. So you get to have a slider scale. What kind of how much you're making your own like leverage ETF, basically.
Yeah. Well, and as it's moving, I'll just say I'm 10x. As it's moving up, when it gets to my first target, or if it gets to an area I think it might turn over, or it's getting overbought on the 60 or whatever, I can you just slide the little lever down, and you're claiming your BTC. So whatever BTC leverage that you made on the profit on the move, you're actually claiming it. It's going right back into Bitcoin. So when you're done with the trade, you're then all 100% 1x Bitcoin.
What's this thing called? BYBIT.
Bybit.
BYBIT. All right, I'm tweeting that out here. So.
Yeah. and all you have to do is you can send BTC from any wallet, address if and you just open an account like that. All you need is a username, password, email address.
All right, so you open an account. I have my stuff in something. What do I have my stuff in? Coinbase. So I could transfer it through the wallet system, that whole, and it sends it right over to Bybit.
Yeah. So if you don't. Right. If you don't have, let's say for example, you wanted some more Bitcoin, you wanted to buy some more Bitcoin, you can do that now in your Coinbase account.
Yeah.
You just go in there and pick your credit card or your checking account or whatever and buy something if you want it. But let's say you had some in there or you bought some or whatever, then you can immediately transfer it over. You transfer it out to your Bybit account if you want it.
And then from the Bybit account, that's where you're going to be doing these trades. You're just taking technical trades. You go long or short, everything.
And I've already made withdrawals, so there's no problems.
Withdrawals into what? Into your Coinbase or whatever your.
I went to I have two hardware wallets, but I went to one of my hardware wallets from Bybit. It had no problems at all. Only took about 8 minutes. Mm-hmm. So, but
interesting.
I wanted to make sure it wasn't one way only things. Yeah.
Yeah. Now you yeah. So you're doing well. You said you're almost up to 5 coins.
Yeah. Well, okay. All right. So I have 2 wallets. I gave some to Emily and Bobby. But yeah, probably close to 4.8 or something like that if I were to add it all up.
Yeah.
And I do contribute though. I still buy some, probably about $200 a month. Maybe if it really drops pretty hard and I think it's going to spike low and bounce, I might grab another $100 worth or something like that. But it's not like I'm dumping thousands of dollars every month or anything. It's probably averaged out to about maybe $200 a month for the past year. Just adding to it. But I try to strategically add to my coin when I think it's oversold, not overbought. But see, what I'm doing is at the same time I'm doing that, I'm also taking the 10x leverage trades.
Yeah.
I went 12x one time. And but I'm taking 10x leverage trades, so I'm actually making Bitcoin with my Bitcoin.
Yes.
And it's interesting because you never even go back to US dollars doing it this way. You just claim it, just a little slider, and you can take it off as it goes.
Yeah, that's interesting. That's got my interest. And
you can set stop also. Just make you can set stops where you want and stuff, and everything is reasonable. They pay market makers versus market takers and all that. It's a little bit different on the fees and stuff, but I don't even notice the fees.
Yeah.
I made 0.117 Bitcoin on my last trade like a couple weeks ago. 0.117 BTC. So what is that? Times 8 Bitcoin's at $8,000 right now. And so 0.117, whatever that is, I remember it specifically. It was 0.117 was my profit.
I'm not going to go. So,
and it cost me it wound up costing me like $34 for the trade in US dollars, if it would have been US dollars. So, the fees aren't that bad. They're not, considering they give you leverage like that, So, but I'm having a lot of fun with it. And
did you see? I asked this the other night when we were talking off the air and about when the attack happened. If you saw a spike in the Bitcoin, and you said it didn't really do it, and then afterwards, I think it was delayed.
Yeah, it was delayed on the U.S. dollar side, but somebody said with the conversion rate to the Iranian money, Bitcoin was the equivalent of $29,000 per coin in Iran. So I guess what that meant was you could have taken $29,000 worth of U.S. dollars, converted it over to the Iranian money, and that's what it would have cost you to buy 1 BTC in Iran. Wow. Yes, but it was fast. It only happened. I have a feeling though, whenever we start hearing, when the bombs start falling and they start scattering like roaches, man, the ones that have money, man, they're going to have to get something to where they can recover it when they get the hell out. You know what I mean? It's a safe haven.
Yeah.
To a certain degree, so more turmoil probably the better for the speculative price on it, but as the demand goes up. People are trying to convert their money by Bitcoin and stuff, so that if they leave the country, wherever they go and stuff, they know Bitcoin, they still have their address. They can, if in theory, they still have it, and one day they can collect it, So the demand goes up on it. And I guess war, or thought of war or whatever can cause that. And especially if we hit them hard enough and they lose their infrastructure and lose their internet and everything, they might think, hey, let me go ahead and get my Bitcoin now.
Yeah.
I don't know.
Yeah, well, it's interesting. I mean, seems like could be some new situations in front of us that could tell, the value of Bitcoin a little bit better if we see this. So you're working on some computers.
Yours almost built.
Oh, yeah?
I bought parts for mine and parts for yours. If mine's junk, so is yours.
I was downloading a program yesterday, and it wouldn't work on my computer at my house, the alien, because it's a new software that it attaches itself to the it's one of the part of the operating system. I'll tell you what it is in a second. Maybe you probably heard of it being more techie than I am. But it was something with X architecture or something.
x86.
Yeah, x86 architecture. Maybe something.
x86 architecture has been out since 1986.
No, it wasn't that. This was something that just recently got updated, like in 2011. So any computers before 2011 don't have this in the BIOS, and it didn't recognize it.
It's just a program that's supposed to run on Windows.
Yeah.
I don't think it would have anything to do with the BIOS. Maybe it was 64-bit, and your other computer's 32?
No, it was definitely not that. It was something. It was a program. I'm trying to remember the name of the program now. It was a program. Let me see if I can find it. I think it was called Personalized Person.
What does it do?
It it makes like a green screen effect on a camera, but it also works for audio and stuff, and it does a lot of.
You're working on trying to come up with some cool effects and everything for the studio idea.
So I got this new camera, but the camera requires this software to run with it, and the software said that my CPU was not up.
It wasn't quite up to spec.
Yeah, green screens. Yeah. Let me see. But I'm curious to hear what you have to say about this, if I can find it. Chroma something. No, was it Chroma? It was something from. No, that's.
This sounds like something that uses Chroma key for.
Yeah. But this was. Damn.
It's going to take some real-time resources for sure to do that, and especially live, But your computer, your Dell at the office is probably powerful enough.
Well, that's what I want to see if I can. I want to see if it has that architecture on there. I got to figure out the friggin' name of it.
Probably just try to install it, see what it does.
Yeah, I got to remember what it was here. I can't remember.
Well, me and Bobby have been researching this for a couple of months, and some of these processors and stuff and RAM and stuff that we've picked out and everything is actually perfect for a trader, perfect for somebody who's going to be doing live streaming. Like you're doing it twice on the same computer right now. So I did some simulations, just putting it on a fake channel on our server, just to see what the video would look like and all. And I ramped all the way up to 1080p. And 30 frames a second, and the total CPU on the computer never got over 2%. And I had the charts open. I had all my email programs open. 30 charts on Bybit Trader. Was open and closing. All sorts of stuff, and it spiked at maybe 5% on the CPU, and stayed like at 2% or less. Wow. And that's running like 4 times the data rate that we run on our streams. So, I've been saying that our stuff was fast enough. We shouldn't even worry about upgrading to some of this newer stuff, and I'm wrong. That computers have made such a leap in the last several years.
Yeah.
Especially the hard drive, Johnny. Oh, man. So, like Bobby has, he backed up all his games and everything. They're like, 25, 30 gigabytes of a game, and he backed the stuff up as a zip file to compress it and move it over to a network drive, and rebuilt his computer and everything, and then he had to pull all the stuff back. Well, I tried to decompress one of his games on my computer, and it said, like, I don't know, 48 minutes, 16 seconds remaining, right?
Yeah.
Do it on his, I'm not kidding you, man. It's 45 seconds.
That's pretty good.
Yeah, and that's because of the CPU, and it's because of the storage now. So they use these NVMe drives that are super fast. There's a tiny little hard drive that actually plugs in right down on the motherboard. It's like a little RAM chip. And they're not more expensive than regular SATA drives or SSDs. They're not really, they're same price. And but I mean, it's measuring at least 20 times faster than what me and you have. So,
wow.
So you have to write files, or like it'll save you time, Johnny, when you're done with like your Camtasia files and all that, and you have to compile it and push it out.
Yeah,
whatever you're doing
I go to dinner. I go to dinner and I come back and it's just getting done. It takes an hour.
You'll get your keys and get ready to go out the door, and the thing will ding, it'll be done. I'm not kidding you, man. It'll at least be 10, 15, 20 times faster.
All right, so I got the same error on this one.
So you did?
Yeah, so the error is this. It requires a CPO which supports the AVX instruction set.
Never even heard of it.
AVX instruction set. Now, I did some search on the some of those tech sites, and I just gave up because there was no way of me adding to it other than changing my motherboard or CPU.
Right. Yeah.
So that was the situation.
All right, so we'll build you 2 computers.
Well, I don't need 2. I just
well, you need one. You need one in the office and one at home.
Well,
something modern. There's some really good deals on the AMD. What is it? The AMD 2200, Bobby? The 2200 series with the graphics built in. The 22 or is it 2700?
22.
Is it 2200? I mean, motherboard and CPU and RAM. You're looking at bargain wise about $200. Yeah, or maybe 300. You add the NVMe hard drive in it. You could build a pretty nice. Computer is 5 times as fast as the one you got now for probably $350.
Yeah. I think this is going to be a good little thing you guys do for the members. I think so.
He needs something to occupy his time and his brain. And he starts school in the morning at like 9 o'clock and he's done like at 11. And he's like, I'm like, where are you at, Bobby? He's like, June. What do you mean June? Yeah, I'm all the way up to June. Well, you're taking your classes for June. That's the summer. He's like, yeah, I'm almost at the end of the year. I'm like, oh. But he's got to pass the test. They're the same test everybody else has to pass in the grade.
Well, is he able to look up the stuff though while he's taking the test?
He doesn't though. He takes it just like you're supposed to. Like if some teacher was standing behind you with her arms crossed, making sure you didn't cheat.
All right.
He sits there and watches a professor and everything on a chalkboard. And then he pauses it and stuff, and then there's a quiz that pops over on the right-hand side, and he'll go and answer the questions, and then the professor will go to the next segment. It's pretty cool. His hardest trouble he's having is computer science, and what's the other one, Bobby, you having trouble with? Computer science and introduction to coding 2.
Oh, all right.
So, ironically, what he's the most interested in, which these are both college courses, what he's the most interested in, he's struggling the most on. He's got like 99 in math, 99 in English, and he's taking an electrical class. I think he's got like a 95 in that. And but math and English are the only 2 that he has to have. So I added 4 more electives on top of that, and 2 of them are college courses, and 2 of them are just regular high school electives.
Market's popping here, highs of the day today. Well, good luck with that, Bobby.
He's I guess I'll put him in 11th grade when he's done. And another good thing too, snow days and stuff that mess up the regular school.
Yeah.
He can just do his work.
Yeah.
He does, and he's not getting sick because he's not going to school and bringing home all those germs. Yeah. So I mean, there's advantages, and he's not getting interaction with the kids at school, but he's still got a handful of friends, the same people he would talk to anyway. So,
yeah, just keep in touch with them.
Next thing I want to do is get certified so I can do the driver's ed thing for him, and I can just teach him how to drive. It's cheaper for me to get certified and to certify him than it is for us to pay, the private company to do it. Open up a browser and you double click it, and it takes up the whole freaking screen. Instead of it just taking. Yeah. So that would be a good thing, like if you split up into 4 pieces, then you just wanted to use Google Chrome, you just have it on this one screen on the left, and then it's not messing, for example, with your stream that's capturing just one of the whole screens on the right or the top right or whatever. You know what I mean? So some people that have multiple screens, they're having a hard time with the idea of having just one big screen, and this would fix that. And you can even set it up with like 6 screens or 8 screens or even more. So you could get like a 75-inch 4K TV and set it up with like 8 screens. So there's all sorts of cool things you can do with it. And I just discovered this not too long ago. One of our members brought it to me. I'm learning most everything I learn, man. I learn from our members,
Yeah, that's good. All right.
And
well, that's
so
I'm going to try that out. I'll probably try to use that because I want to be able to use that for the Rockbot channel. And split the different charts up a little bit better.
Yeah. Instead of having to drag the stuff where you need it, you know exactly where it's going to be, just like if it were separate screens.
Yeah.
So,
and it's
all right, I'll
right.
let you go. We're going to get back to it.
All right, man. Take care.
I might not be able to listen to the whole thing because we're getting ready to unplug a bunch of stuff.
No, it's no problem. I'll be off and on. All right. Thanks, Paul. Take care. All right. There's Paul and Bobby here working on computers here for Day Trading Radio. If you're interested in that, that's I'm getting the first one, and I'm going to be using it, and like I said, it'll help. Bobby's going to be building them with Paul, and offering good deals for the members. The setup here. All right, so futures are at the highs. I mean, let's get back to, the obvious here. Market's moving higher. I had a trader, or actually the stock doc, Rick, the psychiatrist, in today, and he wanted to make sure he wasn't missing out on anything because he's been in everything that are multiple gainers for him, up to 100% gainers. He's made so much money this year, and I think he's giddy to get back over here and find the next good big setup. And the only thing I told him today is probably start to scale into Boeing a bit, but he's in the EXEL. He's holding on to the AUPH as recommended. He's still in. I told him to take off the half of the Veru, which he did, but he's kind of upset. But I think that was a good move on his part. He was up over 100%. Well, 100% he was up on that. It's just, you got to take something off. And we did that into the end of the year, just in case there was selling at the beginning of the year. What you could see, if there was going to be selling, what a better reason than the brink of World War III. That doesn't seem to be holding too much water these days. Hey, good night. So Paul's posting that website in there, rpmpcs.com. It's rpmpcs. rpmps.com. Tell them Johnny sent you if you're out there on the YouTube world. We're going to try to get some cool logos on the machine too. If you scroll down on the machine and take a look at those machines, some of them have very cool designs that they're working on too. The next thing here we're going to be looking at, I'm going to do some scans with you tonight, but I want to grab I brought 2 Cokes in with me, and I want to open up my second one. So give me a second here. I already had my burrito. I already ate. I got a burrito. Oh, yeah. This out of the way. Let me get this out of the way. Paul, if you're out there listening, I forgot to ask you, but just put it in your mind if you can. Couple things. I don't think I'm going to the Florida trade show. It's just a conflict that and I think it's just too much for me. I have garbage smells. Oh God. And the other thing, I am going to Florida though. but I'm going down to see Deep Throat, and it's going to be in March. So if you could cover the days I'm gone, because I'm going to be gone Wednesday and come back Sunday. So went like Wednesday, Thursday, Friday. If you're able to do that, if we could work on that. I'm looking for the dates right now.
Order canceled.
I'll find it. It's March. I think it's... It's depart Wednesday night, so night on the 25th. So it's not even the 25th. It's the 20. So it's just Thursday and Friday, and you do Friday. So it's basically just Thursday, the 20, maybe part of Wednesday if I leave to get down to the airport. Wednesday night I'm leaving. The 25th to the 29th. So the 26th and 27th. 26th and 27th. I'm going to go do a face-to-face. We're going on a fishing trip with Deep Throat. All right, it's the only time he'll talk to me about serious stuff. It's face-to-face, if you can check me for wires. Oh, that's good. That Coca-Cola is good. Let's see here. Nothing really happened after market other than what we have going. The regular market's here moving up. Getting some good action. A nice trend here started on the ES. We're up 650. What if we are up 20 points tomorrow? Boy. So I tweeted out something before, some upcoming key data expected in early 2020. All right, this is key data expected in early 2020. I'm going to post it in the room here, copy. Let me see how it might come all jittered in the room. Let's see if it's able to post there. That's hard to read. Anyway, I'm going to go over some of those stocks right now. I just want to take a look at them while I'm with you. Here's that trend line now before. I forgot I didn't have the screen that you could see me on. So there it is right there. All right, let's take a look at the those charts now. All right, first one on the screen. Some of these you might heard of. Eli Lilly, LLY. Looking at Solendin. I'm not even going to pronounce these drugs. It's impossible. Let's just take a look at the Eli Lilly chart here. And the Eli Lilly chart is absolutely fantastic. It's just like extremely strong. It popped up here. It's really tightly wound up, waiting for the 20-period moving average to come up to it, and probably going to just continue. I mean, why not? It's a drug company. It's a big one, and it's at all-time highs, just off of all-time highs, and it's just resting right now. It looks really, really strong. So, next one, APLS, Apellis Pharmaceuticals, and they have a phase 3 drug. PNH is their phase 3 drug. I'm going to have to look into this one. APLS. You don't mind me doing some research with me, huh? I'm going to look it up for a second. Hold on. What I like about this right away is that it's a recent IPO, 2017, late 2017, you call it 2018. IPO, like initial public offering, I usually look out, going out to about 3 years, 2 to 3 years. Usually, if I could see the beginning of the trading at that point, I'm able to get a good bird's eye view on the stock here. And then looking at this one, you can see it kind of curled all the way back, came back up, I should say. The highs popped through it and sold off, popped through it again, sold off, popped up to it again, and now it's hanging right around that level. So this is actually looking pretty good. APLS. Now, what's the catalyst on this? Let's take a look at this a little bit closer. I'll be right. Let me look it up. Right there on the screen, you can see, if you look up the, you can't really see it, but you look up the, website here, and you usually see a link for a pipeline. And then that pretty much gives you a fast look at the pipeline and what's expected. The APL-2, and again, here's some of these words that are going to kill me, but you can see the top one is the latest expected. It's halfway to phase 3. Open there, ophthalmology. Category. Geographic atrophy. Let's see. Phase 3. And again, it doesn't give you a link there, so you pretty much, what you have to do is it'd be so much easier to just put a link. Say here, go to clinical trials, go to the website review, Instead, you have to copy and paste, a look at the drug, and go down and follow the trail here. APL-2 is the drug. And I'm just going to complain a lot. The website, they can make this font a little bit darker. All right, why does it have to be so soft to the eyes? Make it easy to read. Don't make me squint. Now I gotta get really up and close. I'm thirsty. So, I'm also looking at, I go up to the top and look at the latest news. That's a real fast way to get the latest updates sometimes. It's just to go to the news releases. They usually update you. They put out news releases, and they'll talk about the upcoming events, or if any trials, any endpoints have been met, or anything that's been met here. So on November 8th, we had presents first data on the APL-2 and CL trial at the ASN Kidney Week. Announces third quarter business update and financial results. To present data, and then if we click on this and see if it did give you a link and talks about the data here. clinical stage biopharma focused on development of combat treat disease through inhibition of complement system. Today announced positive preliminary results in the C3 cohort of the phase 2 discovery study. The data showed that APL-2, their drug, investigational C3 targeted inhibitor may have the potent potential to target the underlying disease process. Results through study day 84, 12 weeks were presented at the American Society of Nephrology at Kidney Week, Washington. Based on those results, plans to advance development into a C3G. It goes more on that. Prevent kidney failure, offer results in CGC. There's no medicines currently approved for C3G, a rare disease that leads to kidney failure within 5 to 10 years of diagnosis. In approximately 50% of people in C3G, a part of the immune system known as the complement cascade is overactive and result in the excessive breakdown of protein called C3. We're encouraged by these early results, which show the APL may have potential to address the underlying disease process. Look forward to speaking to regulations upcoming months to advance clinical developments. All right, so I mean, there's a lot of maybes and whatsoevers, and all right, well, that is coming out. Let's take a look. And the chart looks pretty good. Now, if you got the drug there, it'll pretty much tell you exactly when it's due. So what we're going to do is we're going to go back to clinical trials. Let's go to clinicaltrials.com. Trials.gov, I mean. Oh, you know what? If you put a dot in, it just messes it up. I'd better just to put in clinical trials. I don't spell right, but if I just get close, it'll bring me right to it. And then I'm going to go down to that drug. I'm going to put that drug in here. And then no studies found. Perfect. So let's go back to that website. If I could find it. No, that wasn't it. That was... APL-2. Let's just try APL-2. APL-2. There we are. Phase 2 study. Still in right. Active, not recruiting, not recruiting. So let me go back to the website one more time. I'm going to pause this so I don't waste your time. All right, so I'm on this phase 1, brief summary, phase 1. We're in phase 3 on this, I believe. Updated, posted 2019, first posted, last verified. Huh. December 31st, 2020. Did we come out with anything yet on this? Or are we just waiting for this? And it's just the last minute here. It's supposed to be released any time yet. Any time. Estimated primary completion date. 24 phase multi. Alright, so I'll look into this a little bit more. Alright, so we're thinking about that. I didn't see any news that they released any information. It was supposed to come out, and the latest information is that they're going to present the 38th annual JP Morgan Healthcare Conference. Now, I guess the next thing to know is how important this medicine is, and how important, what the market cap is, and some of the fundamentals of this. But it does look like things are set up here for a presentation here. Focused on the development of novel therapeutic compounds and disease to do with the parental open and give credit via live webcast and events, company's website. So that's just going to do presentations, but they're going to probably do some news also. When is that going to be? January 14th at 3:30 Pacific time, excuse me. That's Tuesday, alright. So it'll be after hours our time. So it'll be set up for Tuesday. I don't know, January, that's right around the corner. Yeah, that's the conference week, the 13th. So a lot of these, again, here we go. This is going to be, there's going to be a catalyst on this. I just, would like to know more about the drug, how important the drug is. Is there any competitors? Apparently there isn't, because I read up on that. This actually looks like an and the chart looks great. I mean, one more look at the chart. It's just pinned up here, waiting for these results. And I don't think it's priced in for a year. Normally we get a nice move up to it, like it was pulled back, but this has been chopping around here for a while, so I think there is the potential here. Unless this thing didn't gap down after hours, did it? No, it didn't. Alright, so I have that on the list for tomorrow. I might just see what the options are going to be doing on this one too. Hey Pixie, this is really interesting. I mean, and the chart looks great. So, I might take a gamble on that one. I gotta look into that, but that's on the top of my list right now. Let's go to the next one where we're looking at. All right, so we broke that down pretty good. All right, you see what we do here. It all takes time. Look at me, I'm just putting all the work in here. Day Trading Radio. Hey Pixie, again, if you could look up what their drug does, I mean, it deals with kidney failure. I don't know how big the issue is out there, how many people have it, what's the market for it, is there any competing drugs? Apparently there is no drug for it, so, they have good results that lead them to believe. So if they make it, they make it. If they don't, they don't. It wasn't like, another thing we could see if they're hiring. Did they get any updates here? Apellis Pharmaceuticals. Let's see if we could figure that out. Apellis, Apellis. Let's take a look at it. Hold on, one last thing. Copy. And then what I'm going to do is go to LinkedIn here. And then I want to just log in here to LinkedIn. And then let's type in that company's name. And here we are. Let's go to jobs. And with the job alerts on. So 1 week ago, someone got promoted. 3 weeks ago, Senior Director, Health Economics and Outcome Research, Senior Specialist. 3 days ago. 1 month ago. Associate Director, Field Operations. 1 month ago, Senior Director, Business Development and Strategy. It's fallen into place here. 1 week ago, Senior Director, Investor Relations. Key Customer Manager, 1 month ago, 19 applicants, New York City. Well, this is all in New York City, too. You know what that means? Road trip. I'm going to do a little Bud Fox investigating reporting. I could head down there. Me and Dawit, Starsky and Hutch. Director of Medical Affairs Operation, 2 weeks ago. All these are 2 weeks ago. So something's going on here. Engagement, marketing. This is a lot. Well, how do we know how many? I want to just get it says 39 results, so I don't know if that means 39 jobs that are posted here. But that sure does look good. Let's look at the past week. 22 in the last month, 4 in the past week. 22 in the past month, people. 22 people they're hiring. Coming up to phase 3 trials. I don't believe they have any drugs out there. I don't know what again, we're going to have to work together and see if you like this, run with it. If you come back with any information, please share it with us. But all these things are looking pretty good. I have it down on my list to focus on tomorrow. Let's move to the next stock. And the chart looks dynamite too. Oh, that looks good. Next chart is ACST. ACST. Another interesting chart. You got a big pop. Consolidation started to pop, pulled back. Looks like some news was released, or at least ran into something. Let's take a look. This is ACST, which is Acasti Pharmaceuticals. Acasti Pharmaceuticals. Oh, well, let's start while we're here. While we're here, we'll jump right on that. And Acasti, did I spell it right? Sorry, I blew that word. Acasti Pharma. I guess they're called Acasti Pharma. Acasti Pharma. I want to be technical, huh? Acasti Pharma. I'm still not seeing anything. No matching jobs. No jobs. Acasti Pharmaceuticals. Remember, go into this area. Oh, you go over here to the science. They should have something on pipeline. Oh, they have krill oil. This is the fish oil one, right? I'm in a fish oil stock. What's the fish oil stock I'm in? What's that goddamn fish oil stock? Acasti, eh? No, I don't. No, I don't have this one. Krill oil. Let's bring it up. Krill, is that shrimp oil? Boy, they're going to push everything. They just push it all. World Congress of Heart Disease. All right, so remember we did the fish oil one, which was... Oh, what was the one with the fish oil? Was it PTI? I forget now. Market's pulling back a little. My head is getting filled up. All right, well, remember that. I'm going to go to the next one right now. I'll write it down, ACST. Well, let me actually look one more place over here. Hey. Yeah, absolutely. Data overload. Oh, looks like it popped up from 220 to 220. Starting at $2. Let me hear this. ACST. All right, I didn't find anything really else more here. I'm just looking a little bit more. I'm going to look at that chart one more time. And I wanted to see their news. Let's see if they have released any news and events. Provides update and timing of top-line results from Trilogy 1 Phase 3 trial. So this is the big one. So this came out December 23rd. So here, they're keeping everyone up to date. In November, they had the last reported patient in the Trilogy 1 Phase 3 trial for treatment of severe triglyceridemia. I think I'd handle that one pretty good. And here provides update on timing of top-line results. So they're going to update us on the timing, which is a good thing. Because if they didn't think they had good results, then they wouldn't want us to know it's coming out, I guess. Let's read into this a bit. Bear with me. I'm doing this with you guys tonight, so I apologize. It might be a little boring. This is another Canadian company. Research and commercialization of its prescription drug candidate K-Pre, omega-3 phospholipids for the treatment of severe hypoglycemia. I'm sorry, I'm just awful at these words. Blood levels from 500 to... Tonight announced that it expects to report its top-line results for the Trilogy 1 pivotal Phase 3 trial of Precare in January 2020. The reporting of Trilogy 1 was postponed due to an unexpected delay in data processing and transfer from the central testing laboratory and the statistical consultants for independent and external validation. Acasti regrets the delay due to the factors outside its control and now anticipates to report top-line result in January 2020 as requested by the Investment Industry Regulation Organization of Canada. Due to market volatility, the company indicates there has been no material update to provide at this time beyond the atoned timing update and independent and external validation exercise underway. Implementation of the Trilogy 2 study remains on track, and the company continues to expect the last patient to complete their final visit in early 2020, January. Expects to report top-line Trilogy 2 towards the end of January 2020. Top-line results include a readout of the primary endpoint, which is intended to show K-Pre's overall impact on lowering triglycerides after 12 weeks compared to the placebo, safety and tolerability, overall adverse events, and etc. Will also be reported. Other important secondary endpoints as non-HDNL, cholesterol, and stuff like that. Previously disclosed subgroup analyst key secondary stuff like that. And stuff like that. Highly purified omega-3 derived from krill oil is being developed to treat that until it's fish oil. Krill oil. I like it. They could probably market the crap out of this. Shrink your cholesterol with shrimp oil or whatever. All right, that's interesting. Put that back on the list. T minus a few days, and again, if we look at the chart, it seemed to run up, and then maybe a delay came in. They announced a delay, and then it chopped around, and now it's pulled back. I think we're in perfect time here for this one tomorrow. God, and again tomorrow these lottery tickets. All right, let's go to the next one. This looks interesting, right? We know what's coming. I'm happy about the research tonight. If you're happy about it, give a like to the YouTube channel if you're out there, and if you'd like it here, then stick around. Let me know, because I think we're getting somewhere here. 2 potential FDA stocks that can move, and probably within the next couple of weeks. I mean, that's what we live for. All right, I think the market is pulling back here. Let me just take a fast look here, and I want to just take a look. Yeah, it dropped through this channel line, and has come back down. All right, let's go to the next one. Next one is APLT. APLT. Applied Therapeutics, and that's already got a nice run to it. So, woo. That one looks like the real deal. That's what I like. That's what AUPH looks like. But AUPH looks much better. Applied Therapeutics pulled back today. APLT. They have galactosemia is the drug. This is a recent IPO, it looks like, and it's taken off. Who knows where the sky's the limit on this, right? APLT. Hold on, I gotta take this. Alzheimer's. Someone. Oh, not again. Please, not again. Alright. Alright, hold on. I'm trying to get some more information on here. Let me just work on this. Should pause this. Alright, here's the pipeline. Phase 2, Phase 3. Filed. So a lot of these things are already filed. They're waiting for their... We're seeing if they get approval, I say here. Huh. Tablet, migraines. So what are we looking for? pH3 prevention. So the preventive one here. Preventive migraine. So this is the one. BHV 3000, etc. Alright. Phase 3 study applying preventive treatment of migraines initiated. Phase 3 placebo lasted 48 hours after price and publication presentation clinical trials top line. They have a lot of good information here. I mean, it takes time to go through all this. But it looks interesting. I want to just take another look at one on the clinical trials site. Actually, let's take a look at the LinkedIn site here. Which one am I doing right? Bellhaven? Hopefully that's... Here it is. Bellhaven Pharmaceuticals. Jobs. Recently posted 2 weeks ago. Medical science liaison. Medical science liaison. Medical science. Alright, so see all jobs. 2 weeks ago, liaison. 3 months ago, medical science. Alright, direct business. 4 days ago. 4 days ago. Sort by most recent. Let's take a look. 14 results. 4 days ago, district manager, business manager. 3 months ago, neuroscience sales specialist. 1 month ago, 7 applicants, 10 applicants. Did they hire anybody yet? Sales specialist 3 months ago. Sales specialist. Getting the sales team together. Getting the sales team together. Alright, did I take a picture of, did I get that news? Alright, I think it's that one, right? A lot of work. Preventive of migraines. Alright, copy. Let's go back to the clinical trials. Start over.
Tradometer ES oversold.
All right, active efficacy trial for migraine prevention in adults. That's it, active. This is the big one. It's 9 studies, but that's the big one. Completed. This one was completed. So we're also waiting for NDAs. This was estimated actual primary completion December 10th. What was that? Phase 3 and then placebo. All right, I had to figure out this. All right, so I caught up on this. It looks like they're expecting trial data on the phase 3 preventive migraine medicine this week, actually, this week. And this is only Monday, so maybe tomorrow. I mean, we got to get in here early. Probably take a little position on this just to kind of ride that in there. This is interesting. We should get a pop on it. I don't know if it's priced in. I know there was some news back here. I'm not going to go back yet and check that out, but I don't know if, we had some nice pop there, nice pop here. So I would say we get a pop on this. I could see this being a pretty good trade here. BHVN. I want to put that, save that also. Copy this to my drug list. I'm liking this. Migraine. I think one of this is fish oil or shrimp oil. And then this one was something else. Liver, I think. Kidney. Alright, next one. I'm liking this one. Home Depot. Let's take a look at the HD. Yeah, those look pretty good. I mean, kind of almost was that lower trend line bounce area. I mean, the 200 EMA breakdown, channel line bounce. It had the divergence here. It ran up its first pullback from that divergence. It does look pretty good. There's a trend line retracement. I didn't even put on this one, which feels like that. That's good. So this is what we came up to. Broke down through. Came down to a lower trend line, back up to the original trend line that's set up from this multiple pivot here and pivot here, and then we bounced off of it, confirming it, and that would have been a good short. Now it's pulled back, engulfing pattern starting to turn back up. Home Depot. You gotta love it, right? You gotta love it. It does look pretty good. Volume was good on an engulfing pattern. That's perfect. Nice call on that. All right, let's just take a look at the other one. I don't want to be here all night, but if, money is important. If you don't put the time in here and find these little ones, you're never gonna know what's out there. Checkmate EXEL is one on the list. We already went over that in detail. I just sent the video out on that. So, Checkmate. Oh boy. ELOX. And I sent this out on Twitter too. So this list is on my Twitter, Day Trading Radio. So this one is, wow, way down here. Elox Pharmaceuticals. started to bounce and then slowly ran back up. It's actually very bullish the way it returned back up here from 4 to 8. It almost doubled here. ELOX. Yeah, look at that one. All right. So ELOX. Let me see what that one is first. ELOX. Alex Pharmaceuticals. Copy. Let's start off with our LinkedIn here. Let's do a search on the LinkedIn.
Order submitted.
That's the tradeometer going off here. We have a Rockbot super signal here. Things are starting to get active. So it's an overnight super signal, so it's very slow. I wouldn't put too much into this one. That's about Elox Pharmaceuticals. I'm not getting anything here. Elox Pharmaceuticals. I'm not seeing anybody hiring. Not seeing too much. I don't even see a page for them. Maybe I'd put the company in here. Oh, here's one. There it is. I must stop here. Here. All right. So 1 month ago, associate director, product. All right. And then 2 months ago, let's take out 4 applicants. Principal scientist, associate director, project management, visual. All right, so visual and dental. So that's what they probably deal with. All right, I want to take a look at their company here. Copy. Hey, Mike. All right, so let's throw a little kit on our website. Nonsense mutations, rare and ultra rare cases, highlights, investor news to present the biotech showcase January 14th. So there's a lot of actually presentations happening here coming up, which is next week. Let's take a look at the news and the pipeline. The pipeline, hopefully they have a standard pipeline graph. Sometimes they don't, and they make it work for it. All right, so they have one drug here. No, they don't. My bad. They have more than one thing here. All right, so this is the ELX-2 drug. It's in phase something. End of phase 1. We have completed phase 1 data study, and the results are published in the Journal of Clinical Pharmacology of January 2019. We also completed phase 1 multiple ascending doses. In addition, completing a renal study, mild and moderate severe renal impairment to date. Provide support both continuing our clinical development programs, evaluating. All right, that looks good. Kidney disease. All right, so that looks good. So now they're in phase 2, cystic fibrosis. Ongoing phase 2, entering phase 3. Phase 2, entering phase 3. Some compounds here doing some stuff like that. So, all right, so looks like going back to that, it is Chris. All right. Alright, so at the Americans in the week of Kidney Week 2019, that was November 7th, 2019, to present 31st annual December 3rd. So they came out and say to present new positive data for lead investigational drug EXO at the North American Cystic Fibrosis Conference. That was October. So all around that November 7th and 18th. I just want to see the chart one more time on this. November 7th. All right, there it is right there. Well, November 7th. And 18th, which is right here. The next day it popped and started moving up. So we're due for something coming up. I know it's boring, right, Mike? I'm sorry. It's the only time I get to research if I just buckle down and do it. I'm feeling pretty motivated getting some of this stuff out of the way, even though it's almost 11 o'clock. I want to go through a couple more stocks. But we did find some that I'm going to be picking up tomorrow, the BHVN, the ACST, and the APLS. We'll talk more about it probably in the morning. The ELOX, not you, Alexa, but that one. And then let's see what else we have. We have the XL. We went over that. We have Phase 3 in GNFT. GenFit. And that's already made a nice move. Still waiting for Phase 3. And this is a situation where we're running up into that data. We're running up into some serious data there. And we already... had a nice pop on this. Is it going to get another big pop? That's the big question. Is it going to continue? GNFT. Let's take a look at it. GenFit. I'm going to go to GenFit here first. See what jobs are putting out there. $63 jobs. Foreign company. I don't know if it's Canadian or French. Seems to be quite a few jobs there. Regulatory lead. All right. GenFit. Well, I can tell you right away, I don't like the website. Sloppy website. Oh, it's moving. No, maybe not. Maybe they got a drone. Drone on their website. Droning over. On loop. I'm looking for like a pipeline, but I'm not even seeing pipeline stuff. We'll go to news. How are they? Got it. All right, whatever. Meeting in December. GenFit outcome of ordinary and extraordinary shareholder meetings. November. That's November. GenFit positive 42-month recommendation for continuation phase 3 resolve its study November. Positive 42 DMS. That's November 26th. Let's take a look at November 26th. Yeah, right there. Gapped up sideways and ran. Yeah, it looks French to me. GNFT. But the website, it looks like a French website. It doesn't look like that. It's a little confusing. It's not confusing, but they have no pipeline here. Oh, it's kind of crashing my overview. They don't have much going on. Latest presentation. Upcoming events. They'll also be presented at the JP Morgan Healthcare Conference. A lot of these companies are going to be presenting at the JP Morgan Healthcare Conference. This is G. I'm going to write this one down. GNFT. JP Morgan event. Again, another event. They don't say they're going to be announcing there. Oh, it did before. Press releases. Let's see here. Upcoming events. So they could drop some news at that thing. Where are they located here? Massachusetts. No. France. There it is. Headquarters in France. I got to look at the presentation to get a further read on this. Yeah, it says, I'm not liking it too much. ELOX. I wrote it down, but we're going through these. ITRM, Phase 3, Cootie, I think that one just came out, ITRM. It's funny, I have none of these. Hopefully mine are all under the radar. KPTI, Boston, Phase 3. KPTI. Let's take a look at that one. KPTI. Oh, that looks like a pretty good chart. Copy. Let's take a look at the chart first on this one. KPTI. Is the stair stepping up? I feel we missed a big move in this. It gapped up and ran. It's not out of control though. It's not out of control. I'm curious. Yeah, I hate reverse splits in some of these stocks, and some of these stocks will have that history. All right. What am I doing here? I'm looking at another site now. Hold on. All right, their pipeline. Got some Gatorade here for me. That's good. All right. Here's the Boston. This is the one that's in phase 3, almost done with phase 3. Drug is Selexidor. Right. Boston is a phase 3, 2-arm randomized active open label study that will compare efficacy, health-related quality of life, etc., of Celemix or plus some other drugs plus low dose of this versus that, and a low dose adult patients relapsed refractory multiple myeloma who have received 1 to 3 prior anti-multiple myeloma regimens. All right. It's and please visit our clinical trials dot. See, that one gives you a. See, that's perfect. This guy, they know what to do. They put a link right to their clinical trials. Thank you very much. At least this company seems to have a little on the ball right here. From June 2020, it says. June 2020 is when the endpoint is going to be done. June. So, I mean, all right. So what's that one? This one is the KPTI. June 2020. Good night, Pixie. Sorry we didn't hang more. Trying to find the next nice key one here. I got a couple on the list. All right. What is this one? KPTI. KPTI. Just looking up one more thing. Be right with you. All right. Let's take a look at the next one. TGTX. Nice flag on this. This is what I expected the EXEL to do. You know, this is kind of almost a similar pattern to what we're watching the EXEL. It's just that last pullback before turning back up and breaking through it. So we look at that EXEL. It's not exactly like this, but it has a similar downward move down. And this last pullback, we're going to look for this to push up and eventually drive out of this channel as new data come in and stuff. That's an interesting one. You know, love the chart, love the pop on it. I think we get follow through tomorrow. This one had this, and we popped and eventually got through, but this is that pullback, and then we had oversold level, and then we started rotating back up and slowly grinding. Once we start to get that momentum going, then we can start to see this thing possibly move. Now, this has already moved up. I mean, of course, if data comes out, this will continue to move. TGTX, I guess we should look at it fast. I don't know what it does. Unity, and then, well, let me just look at the other chart here. A couple other ones I want to go over. I'm really going to get out of here. VRNA. Again, this is sometimes what happens. You pop and then you drop. This is actually looking pretty good. VRNA. Let's look at this one fast. Take care, Warbucks. That's interesting. Went from $4 to $12, and then right back down to $6, and then right back down to $5, and now starting to turn back up. Verona Pharmaceuticals. I gotta look at it. What the hell? All right, let's take a look at this. What is it? VRNA. VRNA. COPD. COPD is that breathing disease, which my mom passed away from. COPD, from smoking. That was pretty horrible. Verona Pharmaceuticals. Let's go to the website. United Kingdom. Did they do a deal after they came out with the news? I gotta look now. What the hell? Why did that sell off? I have to write it down. COPD Phase 2, VRNA. All right, let's take a look at that. VRNA. No news on that. All right, here's the latest news on here. Verona Pharmaceutical jumps 45% on looming trial data. Shares of UK-based Verona Pharmaceuticals soared nearly 45% on something. Looming trial data here. Extended, all right, and add another 20% extended trade as the company awaits data from its Phase 2B dose ranging study evaluating the effects of nebulized anacetrine as an add-on treatment with long-acting bronchial dilator in patients with moderate to severe chronic obstructive pulmonary disease. Company lead product candidate is first-in-class inhaled dual
Order filled.
inhibitor of the enzymes, etc. All this crap about it. Single compound. On January 14, 2019, company announced its 3-day Phase 2 trial valuing a dual kind of a chronic did not meet the primary endpoint of peak force expiratory volume. Following the news, the stock plummeted 30% to close the day at $6.97. The results of the second phase trial, which is a 4-week placebo-controlled dose-ranging Phase 2B trial evaluating nebulized anacetrine, add-on to the inhaled stuff, commonly used in treat patients with chronic obstruction, are due out by this year end or in the first quarter of 2020. The study will help inform the planned Phase 3 clinical trial development, which is expected to start in 2020, according to Verona. Company ended September 30th with cash of $50.5 million. I'm going to be coming down your way, Mike, to see Deep Throat, actually, in March. What am I looking at? VVV. I gotta look at that Kodak too. CEO and Sava raised stake. When was this? All this news out? January 2nd.